Welcome to Pawsitive Health, where we believe that pet owner education leads to better pet health. Just a quick friendly reminder, this video, as well as any content on this channel, is for informational and educational purposes only and should not be used for any diagnosis or treatment for your particular pet. Please contact your veterinarian for your specific pet health needs. Today, Devlin, we'll be going over flea preventatives and why it's such an emphasis for us as veterinarians in your pet's health.
Yeah. Especially as the summer months are here upon us and, they are out in droves, we are quite quickly reminded that it is time to be a lot more vigilant in our flea preventatives. But realistically, this is something that we should be doing all year round.
Exactly. So yeah, as far as flea control goes, a common question that's always asked is, I don't see fleas, so why should I get flea preventative every month? And just because you don't see fleas doesn't mean fleas aren't in the environment and your pet hasn't been exposed. In fact, if you do see fleas on your pet, most likely you've got thousands in your environment already. And so the key word in flea prevention is prevention. We're giving these medications so that you do not see fleas and you don't ever want to see them. Because once you see them, you've got probably an infestation, and those can be very hard to take care of. And also, flea prevention is not only because of the fleas and what they can cause as far as itching, but it can also cause issues as far as other health issues as well.
And also, preventing them is a lot cheaper than all the stuff you'll have to go through to get rid of them. And
yeah, exactly. So fleas are not just annoying. They obviously can cause itching and inflammation due to flea allergies. And because of that scratching and chewing and itching, they can cause secondary bacterial and yeast infections to your pet. This can happen with just one bite. I mean, you can have one flea jump on, bite on them, they can be itchy for weeks. Also, if you do have a heavy infestation on your pet, especially if they're young puppies or kittens, or if they're older animals or medically fragile animals, they can cause some serious anemia, since fleas feed on blood. And if you have a significant amount of blood loss, you'll get a significant anemia, and that can cause some major harm. Fleas can also jump onto us and bite us and cause issues. Fleas are known to transfer certain diseases. In fleas, you can have ELIVA for tapeworms, and so when your pet chews and bites a flea and eats it, they can be infested with those tapeworm and then get infested with tapeworms.
That's crazy. You're telling me that the thing that eats blood is going to come after us?
Yes. I mean, vampires
can you have blood?
Yeah. But yeah, so they can also transmit other diseases such as like Bartonellosis, which is cat scratch fever. They can transmit something called Yersinia, which is a bacteria that causes the plague. In fact, that was the main reason for the plague outbreak back in the day, because of rodents and fleas. And of course, we know how that played out. Fleas can cause a lot of other issues other than just scratching and itching. So flea prevention is not just both a parasite control, but it's also infectious disease control. And fleas are a health concern and not merely just helping with cleanliness and itching.
Yeah. None of it to relive the plague. Although those masks were cool, I don't think it's worth it to go through all the itchiness and stuff just to get those cool masks. The plague doctor mask. Yeah. I mean, I grew up in a house with a lot of pets. So fleas have been a part of my life for all of my life. And it was well known that as soon as you saw a singular flea, that it was already an infestation. So anytime, that we would see like one of the cats was, biting at the base of their tail or, scratching under their neck a lot, I was like, all right, get out the comb. Let's go look through the fur and see if there's any signs of like the eggs or active fleas or whatever. But also like we'd find out just because we were getting bit. It was that kind of an environment. So yeah, I mean, most people are going to think that they're just annoying, but no, they can be bad. I mean, I remember it would be so bad I would be scratching until sometimes I would get an infection there just because of how badly I was scratching at the fleas. So we learned a lot. Like baths are definitely like a good thing, but definitely not all that we have to do.
Absolutely not. Yeah, flea baths or just doing bathing is not going to cut it. Usually, when you see fleas on your pet, they have already fed and started reproducing, making eggs, and those eggs will fall off the pet and then go all over the environment. They'll be in your furniture, in your bedding, in your vehicles, outdoor areas, even in your tile grouts, on your leather couch. So it doesn't have to be carpet or anything of that nature to have the flea eggs. It can be anywhere. And so, of course, those eggs will then hatch, go into larvae. Those larvae develop into pupae, and then you'll get new adults. And then, of course, those adults need to feed, jump on your pets, on you, and feed, and then start the cycle over again. And so when you see a flea, you probably already have all those life stages in your environment and already have an infestation going on. And once again, that can be very hard to control.
Yeah. So basically, see a singular flea and know that you have a hatchery, a nursery, a live colony of fleas, and probably a graveyard of fleas somewhere in your house.
Right. Yeah, that's correct. So the household environment is a major part of the problem. And doing a shampoo or one of those short-acting flea pills may kill the adult fleas currently on your pet, but it doesn't provide dependable ongoing protection or eliminate all the developmental stages in the home. And so established infections can take months to take care of, and it takes not only treating your pet, but also treating the environment as well. Also, you can't just selectively treat one animal in the household. All animals in the household, every dog, every cat has to have the appropriate flea preventative in order for you to fully have control of that infestation and flea cycle.
Yeah. Yeah, definitely want to do that. But all right, let's talk on this one because it's been a long-standing myth. I know, especially in my family, my mom's family, a lot of us would say, "Oh, but I only need to do it during the summer months." Now, you and I both know that that's not right. We do need to do it during the wintertime as well. So why don't you tell them why?
Well, I mean, in most places, especially here in Southern California, there's really no off season for fleas. The colder seasons aren't actually that cold enough where fleas won't be a problem. And even in areas where flea or the environments can be cold enough to stop fleas, we still have heated homes. We still have traveling pets, wildlife, visiting pets, boarding facilities that creates ongoing exposure for your pets, even in a place like Minnesota where it gets super cold. Um, yes, the risk varies by climate and location, but the gaps in prevention and with the ongoing exposure opportunities, even during the colder months, can reestablish the infestation. And then once again, you're fighting that uphill battle to take care of that infestation in your environment. So
Yeah.
consistent prevention is easier and less expensive than treating an infestation and taking care of the secondary issues that fleas can cause to your pet, such as skin allergies, infections, and other infectious agents that they can transfer.
Yeah. I mean, we also have to think about like fleas aren't just right around your home. You might bring one from work, you know,
Mhm.
they like a warm body, so they may just stay, in your warm body in those cold climates. So it doesn't really, that's another reason why it should be year round.
Yeah.
And I mean, that kind of ties into the next thing we were to talk about is like, since you are one of the reasons that it can be brought into the home, it will still affect animals that don't go outside.
hmm So yeah, I mean, even if your pet is strictly indoors, doesn't mean they can't get it. It's kind of a funny story. We had a client of ours say that they don't flea control because they're in a gated community. And so apparently fleas don't like gated communities, which is hilarious. But yeah, fleas don't care where they're at. They'll go indoors, outdoors. They'll travel on your clothes and other pets that come into the household, rodents or rats that come into your house, or other wildlife that can come into your house. They'll be on them, and so there's always going to be exposure, even for an indoor animal.
I can't get over that. We live in a gated community, so we don't have fleas.
Yeah, I mean, that took us by
Is it because
surprise.
fleas
After
don't get up to 55 years old? Is that what it is?
I don't know. Maybe they don't know the gate key or something. I don't know.
They don't know the gate code. They can't hit you right.
Yeah, exactly.
Okay, so to make things simple for the general public, you don't have to buy just a singular thing that only deals with fleas. You can get it all lumped together with the other preventatives that you need.
hmm Yeah, and that's going to be your prescription flea controls, and not every flea control is for every pet. There are going to be decisions that are going to be made by your veterinarian as far as which one is going to work for your pet. What we consider is your pet species, cat or dog, their age, their weight, their health history, lifestyle, what is the local parasite risk as well. We also consider whether the pet or owner prefer an oral topical agent, and what can the owner administer to the pet consistently. The goal is not simply to kill fleas, it's also select the safest product that provides the best overall parasitic protection for that particular pet. And like you're mentioning, a lot of these newer flea controls, prescription flea controls, also can cover a wide variety of parasites, not only fleas. It can cover ticks. Majority of these products have tick prevention in them, like Simparica and NexGard and Revolution, somewhat. A lot of these combo flea preventatives can also treat heartworm and intestinal parasites like Simparica Trio or NexGard Plus. Revolution Plus also can take care of heartworm as well. Um, They can take care of mites. Revolution, we use a lot for ear mites. Off-label, Simparica and NexGard also help with mange, so demodectic mange or sarcoptic mange or scabies. But that's obviously off-label, is not on the label, but we do use them for that. And then, like we mentioned before, even though it doesn't treat it directly, it can prevent tapeworm infestations because you're getting rid of the fleas, and then you're not having your pet ingest the fleas and get a tapeworm infection as well.
Which, would be a nice thing to prevent. And preventing
Absolutely.
all of those would, be a lot cheaper than treating them. So,
Exactly.
again, another good reason to do it. But the cost is always something that comes up. So people are going to ask about the over-the-counter stuff. One of the most notorious, and thankfully most, at least cat owners, are well aware that little stinky collar that you get, from the grocery store is not only useless, but in some cases harmful to the pets. So, let's talk about why we can't get like the cheap stuff, why it's not actually that good.
Yeah, over the counter doesn't necessarily mean that they're not effective or unsafe. But I kind of look at it this way. There's an analogy I have where you're trying to get from point A to point B on a freeway. It's like 100 miles. Before flea prevention, all the flea baths and just trying to take care of it that way as far as your environment and trying to just get the fleas off. And that's kind of like walking. And so it's going to be very, very hard to get to your destination. In fact, almost impossible. And you're always going to have an issue of being able to get to that point. The older flea controls that we had were a game changer at the time. And that's like getting a bicycle to go on the freeway to get to your next destination that's 100 miles away. Yes, it's much better than walking, but it's still going to be a pain to get there. It's still going to be hard to get there, and you may not get there even on a bicycle. Now, with our newer flea controls, our prescription flea controls, it's like getting a car. And with a car, as long as you're using it properly, you're able to get to your destination, get to the point where you can take care of these flea infestations properly and safer as well. Concern is with over-the-counter products is that owners are selecting these products without really knowing whether it provides the right safety, duration, and parasite coverage that their individual pet needs. Now, with the prescription medication, your veterinarian is going to select specifically for your pet, considering their medical history, their age, their weight, lifestyle, and so we would be selecting something appropriate for your pet. We may be even selecting a combination product because we do want to take care of those other parasites like ticks and heartworm, mites, intestinal parasites as well. The over-the-counter short-acting treatments like the Capstar pills and shampoos, yes, they do work short-term, but do not provide lasting prevention. And that's what you need to not only prevent further fleas getting on your pet and causing issues, but also breaking that flea cycle and those infestations in your environment. Another thing that, thank goodness I don't hear as much nowadays, I'm sure it still happens though, is using the wrong flea control as far as species or even weight size. So I know a lot of people back in the day would take like a large dog flea control and try to break it up so they treat their individual, cat or small dogs, and that's can be very detrimental to them because it's not a homogeneous mixture. And because of that, even though you think you're giving a quarter of it to your pet, you could actually be giving the whole dose still, or still a larger dose than they should to your pet, and can cause some serious illness to your pet or toxicity. So with that, we don't recommend splitting products, even the newer products, between your pets. Another thing with prescription flea control is that if there is any suspected product failure or adverse reactions, us as a veterinary team and in coordination with the manufacturer can help investigate that and figure out what's the best course of action for your pet and in general.
Nice. So definitely the over-the-counters are not the best solution.
No, yeah,
it's not really curated for you.
Yeah.
And how surprising, the large dog dose doesn't make the puppy get rid of fleas faster.
No, exactly.
Okay, so because of how difficult it is, why can't we just wash their bedding then and consider it to be done?
I mean, it's not just we wish it could be that easy. The flea life cycle is very hardy at every stage. And so you'll need a multi-stage attack against the source of the problem in your environment and your pet as well. Obviously, before engaging in using any pesticides to treat your environment, please consult with your veterinarian about what is the best and safest for your pet. You can call a professional as well. Professional is probably your best bet as far as taking care of fleas in your environment. You can do DIY products such as foggers. With foggers, make sure that you and your pets are not in the area when those are.
Please don't stay in the room.
And then clean very thoroughly afterwards. You can use outdoor pesticides to treat the outdoors. And then, of course, washing your bed. You can use a bleach solution, high heat water to help kill the fleas or any other parasites that are in the bedding, in your clothes as well, because once again, your clothing can be bringing in those fleas. So washing them as well. You can use powders you can put in the carpet. Make sure you have a good vacuum to vacuum it up and clean it thoroughly. These can take some time to kick in and treat, sometimes up to 24 hours. A lot of times within a couple hours they're working though. Not all of them can be used at the same time. Please read safety information and consult a professional before using these products.
Yeah, I even saw when I was doing a little bit of research on this for us as well, that they have like sticky traps that you can like put out. That use like an attractant that hopefully get it. And when I was reading it, you and I were talking about beforehand, I see it more like an early warning system, right? Because our whole thing is like you see one and like we got a big infestation. You wouldn't use something like that as like an actual preventative. So
exactly, yeah, you're not using
it's not preventing, it's just showing you like, hey, this is here in your house.
Yeah, exactly. It's just a warning that there's something bigger that's out there. So not necessarily used for as a treatment, but definitely what I'm saying. But once again, as long as you're taking care of your environment, taking care of your pets consistently, then it should hopefully be a problem.
Yeah, hopefully. I mean, the one thing I talked about early on is like, like if we saw them scratching, it was like, all right, that's probably what's going on. Let's go search, let's verify and find them. But, sometimes we'd just be sitting there, petting our cat, petting our dog, whatever, and you find a flea on there. And they had never given you any signs whatsoever that they had fleas. It was just, hey, look at here. Here's a flea. Oh, crap.
Yeah. I mean, every pet's different as far as how they react to fleas and flea bites. I know lots of pets that have 1,000 fleas on them and they're not itching or doing anything. And then you have that dog or cat, and they get bit once and they're itching and scratching for weeks. So there's a broad spectrum as far as their reactions, and so you cannot just go by scratching alone to see if they have fleas or not.
Yeah. So, I mean, one thing we were taught to look for, we called flea dirt. It's usually at the base of the tail. What is that exactly?
Flea dirt is basically their poop, and so they're defecating on your dog. And so that may be the only thing you see. Exactly. And then you may see, scabbing, hair loss. It may be excessively grooming, like we mentioned before. But by that time, the damage is done. It's too late, and obviously you need to bring it to your vet.
Yeah. Now, let's say, I've been doing the preventative and I still spot a flea. Does that necessarily mean that the preventative is not working?
No, it doesn't mean that at all, because you have the fleas that are on your pet, but then you got to remember there's also larvae and pupae in your environment. So once again, you need to take care of your environment. And if you don't take care of your environment, you're just going to get new fleas jumping on them and biting your pet. And so until you break that cycle, you may still see fleas even if you're on a good flea control consistently.
And then let's say, I'm adverse to, those big chemicals that are in there. What about the natural remedy stuff that we hear about?
Yeah, natural remedies aren't necessarily better or safer for your pet. Those concentrated oils or other home remedies can actually be poisonous to your pet and irritant to your pet, especially to cats. Cats are very sensitive. So even natural products you have to be careful with, and majority of times they don't do too much either.
Yeah. And I know we mentioned a little while ago, but should mention it again. Dog preventatives for dogs, cat preventatives for cats.
Yes.
Keep it separated.
So please don't try to split up a flea control to save money. That does not work. In fact, it can be detrimental to your pet. At the very least, it may be where it doesn't do anything at all because you really didn't give much. But it can be up to the point where it can be toxic, and then you're bringing your pet into an emergency and costing you thousands of dollars to treat the toxicity that you just gave to your pet.
Yeah. Now, what things do our pet owners need to tell their veterinarian if they spot a flea or they're going to start a preventative? You can't just say, "Hey, I found a flea on sugar. What do I use?"
Yeah, and so your veterinarian is going to want to know your pet's current weight and age, if they're nursing or pregnant, current medications or supplements, if they've had any reactions to previous flea or parasite products, any history of tremors, seizures, or other neurological problems. Those are very important, especially with the new isoxaline products like Nexgard, Simparica, Revolution Plus, because even though these products don't cause seizures, if your pet has a neurological condition, it can lower the threshold for seizures, and so seizures can happen. It doesn't mean that these should be completely avoided. It's just needs to be carefully selected by a veterinarian with the help of a thorough history from you as the pet owner, provided to the veterinarian to discuss what is safe for your pet.
So does that mean like if a breed is known to be susceptible for seizures, that we should be staying away, or letting like right away, like, hey, I've been using this product on this dog? Like, what is it? Is it border collies that can get it?
Your gene, yeah. So that's a big thing with ivermectin products and everything, which we don't use too much. I mean, Revolution is a kind of like an ivermectin product. It's salamectin, but usually we don't have much issues with that one. But that's a little different with that. But like I said, if you have any concerns, please consult that with your veterinarian, and together with your veterinarian, you can decipher what is a best course of treatment for your pet.
Okay. So if you could sum up just one major takeaway from this long discussion, what would you say it would be?
Fleas are much easier to prevent than to eliminate. So trying to get rid of infestation is much harder than just not having an infestation in the first place. Fleas not only cause flea allergy from their bites and causing skin disease and infections, but can transmit other parasites and infections. And so that's why we harp on you guys as far as keeping them up on your flea preventative year round.
And making sure that the right preventative is being used, because not every preventative is right for every pet.
Exactly. Ask your veterinarian which product provides the appropriate coverage for your pet, and then use it consistently. If you already see fleas, please contact your veterinarian. Most likely every pet in your household is going to need a flea control or flea preventative, and then starting a routine as far as trying to control the environmental stages in your environment, and then just being patient. It can take some time, being patient, and then hopefully you can break that cycle, start the prevention, and hopefully never get that infestation again.
Yeah, and let's just make sure that we tell everybody that we're sorry, John, because if they're like me, that they've been itching through this entire episode.
Yeah. Yeah. I had a dog today that had some fleas, and I was itching the entire day, man. It was awful. And I didn't have any on me, but I was feeling it. It's a psychological thing, I guess.
Yeah, like anytime somebody mentions lice, start see just like that, mention lice, start going.
Oh gosh, yeah. Exactly.
As always, we need to tell our people about the Pawsitive Health community.
And if you like this video and found it helpful, please like and subscribe, and please comment down below if you have any other topics you'd want us to discuss. We also have a school community. Let me see if I can bring that up. Nope, that's not going to go, is it? Nope. So we have a school community called Pawsitive Health, where you can join and join other pet owners and discussing your pet's health. There's a discussion board on there where you can ask your questions, and I myself will be on those discussion boards and help answer your questions. We also will have routine live Q&As where you can ask questions to me directly, and hopefully I can help you better understand your pet's health, or if they have any issues, better understanding those as well. There's also going to be much more with the community as far as resources and much more other things. So go ahead and join, and hopefully we can better educate you guys and keep your pets as healthy as possible.
Thanks for watching, everybody. We'll see you next time.
All right. Take care.